Every Thursday, we're taking a look at a health issue or concern affecting many people, breaking down the information for you and telling you what you need to know to keep you healthy. Dr. Kalani Brady from the Johnny Burns School of Medicine joins us now with this week's topic, menopause. Good morning, Dr. Brady.
Good morning, Kelly.
Okay, so many of us have heard the phrase, some may not know, some of us may have gone through it. What exactly is menopause?
Menopause is the time when the ovaries stop producing the hormones at the level that they do in fertile women, for example, 20 or 30-year-olds. It usually occurs at mean age of menopause is about 51 years of age, and 95% of women have menopause start between 45 and 55 years of age.
Okay, 45 and 55. Now, I didn't know about this, but apparently there are effective ways to treat it. What is the most effective?
The most effective is estrogen or hormone replacement therapy, and it really helps with those, what we call in medicine, vasomotor instability, which are hot flashes, which are the bane of women going through menopause, waking up in the middle of the night, drenched in sweat, feeling horrible. And estrogen can help with that marvelously.
Okay. Now, how can you get this therapy? What does it take to get estrogen?
Oh, go to your regular doctor or your female doctor, and you can get hormone replacement therapy.
Okay.
So not only does it help with hot flashes, but it helps with mood stability, because there's a lot of instability of mood in menopause. And when you take hormone replacement therapy, it elevates the mood and decreases the amount of depression that we have. It also treats vaginal dryness, which is a real problem for women in menopause and thereafter, and basically can result in women deciding not to have regular relations because it's so painful.
Okay, well then it sounds like, you know, a win-win. Don't most people then get that, or why would you not get the estrogen?
You know, in the 1950s, everybody got hormone replacement therapy. It was basically thought to improve heart risks, which it doesn't. And so we don't recommend it for treating heart disease, osteoporosis, or other conditions. But there are some side effects that you don't want with menopause, with hormone replacement therapy. So not everybody gets it these days.
Gotcha. Okay, so what are the ways then estrogen can be given to a patient?
You can get it by oral tablets. You can get it by gels and lotions, and you can get intravaginal creams and tablets as well.
Okay.
So there are a lot of different ways. Put it on your skin, intravaginally, or just pills.
Okay, and then you mentioned, you know, from taking these, there are some risks or some negative side effects. What could those be?
Oh, the negative side effects basically are heart disease, a small amount, invasive breast cancer, stroke, clots in the lung, and hip fracture. Now, Kelly, these only occur in 1 to 2 women per 1,000 in 5 years. So that's a pretty rare side effect. It's not like 4% or 1 out of 10. It's 1 to 2 per 1,000 in 5 years.
Okay, wow. So then very rare.
Very rare.
Okay, so those are the risks, which sound scary, but again, are very rare. What are just kind of the more common side effects that are maybe more tame?
Women can get breast tenderness. That's a dose-dependent symptom. So if you're on a higher estrogen, and we recommend a lower estrogen to start and gradually increasing the dose to treat the symptoms. But if you're on a higher dose estrogen, you can get breast tenderness. And another one is that shortly after starting hormone replacement therapy, you can actually have something that is like a period for a few months, and they usually go away after a few months.
A few months.
Right.
That's a big underline.
But it's not the strength of a full period. It's just a little, usually a little spotting.
Yeah, but for many women going through menopause, you know, going through the mood swings, going through the hot sweats, that's worth it, right?
Right.
All right, well, thank you so much for all those tips. Again, all of us women have to go through it. This is a great way to deal with it. Great options for therapies.
Yes, indeed.
Well, thanks so much, Dr. Brady, for all the info. You're going to be back next week. Do we know the topic?
Yes, but I forgot it. No, dementia.
Dementia. Okay, perfect.
Has a lot to do with being forgetful.
So I've heard. Well, we're going to learn all about that next week with you. Thank you so much for all of your tips on menopause treatments. And if someone wants to, if they think they're starting to go through menopause, what should they do? Who should they contact to possibly get some of these hormone therapies?
See their regular doctor or their female doctor, OBGYN, and they will be more specific in benefits and risk. Do you know that there were less cataracts in people that have hormone replacement therapy?
I definitely did not.
So there are all these benefits that we don't have time to talk about today, but you see those doctors and they'll go through all the benefits and risks.
Perfect. Thank you so much, Dr. Brady.
My pleasure.
And ladies, good luck.